have to remember who we are.
Welcome to Health and Wellness. I'm your host, Roseanne Green. The physical demands of firefighting are very difficult and require an extremely high level of physical fitness. Candidates, recruits, and active firefighters must possess high levels of cardiovascular fitness, muscular strength, muscular endurance, flexibility, and low levels of body fat. The need for firefighters to be fit seems obvious. A fire axe weighs around 20 pounds, and an oxygen tank can weigh up to 50 pounds. Adding the big boots, jacket, unruly fire hoses, and demanding emergencies. And you believe that most firefighters are in peak physical condition? You'd be wrong. With me on the show today is Dr. Adrian Miranda. He's a board certified specialist in orthopedics. He received his doctorate in physical therapy from, you can pronounce it.
Ithaca College.
Thank you. He currently works at Windsor Physical Therapy in Brooklyn, New York, and he is a professor at Torah College Orthopedic Residency Program. He is also the creator and host of the wonderful show, Move Well. Welcome to the program, Adrian.
Thank you
So much for being on the show.
My pleasure.
And it's a very interesting topic that we're going to discuss today because most persons believe becoming a firefighter and the first test they do, that's enough for the rest of their career. Talk to us about that. Take us through that process.
Yeah. Well, first of all, I'd like to say that I have a special place in my heart for firefighters. I grew up in Washington Heights in the '90s, so
Okay.
it was a busy area and
Right.
a lot of stuff going on. And so I got escorted by firefighters. There was fires quite a few times in my building growing up. And then as a physical therapist, I've been seeing firefighters where I work at. We see a lot of firefighters. And so it just seems that there's not enough knowledge or education about the human body in regards to firefighters. And they have such big demands as you read in your introduction.
Right.
So I think we just need to educate and talk more about what the demands are and how firefighting is a pretty physical and athletic job.
Right. For the process in terms of the training, take us through the training of different movements of the body, especially the drills that they have to go through.
So first of all, it's not so much so that so the training gets you into the academy, and then even during the academy there's drills. But let's take it forward where in real life they have to do things that are similar to their drills, but there's also unexpected things. And this is stuff I'm going to tell you about stories that patients tell me. So I'm no firefighter. I haven't been to the academy. I would love to go and see exactly what they do. Maybe even try some things myself. But as you read, you have 50 pounds of a tank and 20 pounds of something to carry items. So there's a huge physical demand, first off. So it's not just your own body weight. It's adding equipment.
Right.
Then add somebody who you have to help. So you might have to carry someone or guide someone or hold on to someone semi. So in reality, when they tell me these stories, they tell me, oh, I had to pull a 100-pound person from the room. I had to help them lift them up or carry them down the stairs.
Right.
Those are things that drills kind of teach you. But once you're out in reality, you don't have to keep doing those drills over and over.
Right,
So once you're in the academy, once you pass, once you're a firefighter, you don't always have to kind of recertify.
Right.
So you have to prepare yourself for the unexpected.
Right.
The other thing that they will tell me is that debris falls on them, or someone else, or one of their own firefighter colleagues falls on them.
Right.
One of my patients told me a story where he was on the floor and there was debris that fell and hit his knee, and it hit his knee this way, and he has very stiff hips. So if you consider a stiff hip almost like a brittle twig, where you can like snap it like a pencil,
Right.
if something falls on it, it's going to snap really quickly. If you're more like a willow tree, okay, or a palm tree, right, where you have a lot more flexibility, something falls on you, you have a little bit more leeway to get an injury.
Exactly.
Traumas are going to happen. Things are going to happen that you can't expect. However, in those people that are active, they've done studies, the more active you are when you have an injury, the faster you recover.
Okay.
So kind of going back about drills and training, drills and training do something there in that moment in time, but they don't necessarily always train you for what happens in real life. In real life, you have to kind of consistently be training.
Right.
for those unexpected things. And so that's why you read about flexibility is important, cardiovascular endurance. Your muscles are heart, so people sometimes forget about that.
Exactly.
But then you have, you're running up 12 flights. I was on the 6th floor, and so in the fire, you can't, growing up, it was a 6-story building. I was on the 4th floor, so for fighters to come up with all their equipment, you have to have a certain amount of cardiovascular fitness.
Exactly.
So if your heart isn't strong enough, doesn't have the cardiovascular endurance, which again, it's a muscle, it can't pump blood and oxygen to the other muscles. So other muscles get less oxygen, and they're going to fail faster. They've done studies on different athletes, but like in dancers, the more injury, the more hours you're exposed and the more fatigue levels you have, the more injuries go up. So the amount of hours, typically people get injured, have severe injuries when those hours are kind of exponential. So the more endurance your heart has, the more oxygen gets pumped to muscles, and the healthier they are throughout situations. And the nice thing is that our bodies are really good at compensating or cheating, and it's really good at going from point A to point B no matter what it takes.
Right.
So if you need to save someone, you're going to do it.
Right.
However, you have to consider the consequences where adrenaline's going to kick in and you're going to be able to do it.
Correct.
But the consequences are that afterwards you're going to suffer.
Exactly.
Okay, as opposed to, you do that, and then when you get out of the building, maybe, I mean, I hear stories from patients that they're like crippled, they're hurting, and there's plenty of, that CNN article talked about how people have heart attacks, and it's sedentary, overweight, obese, people in the fire department, fire chiefs that go in a big building, and they have a cardiac arrest, and they have heart attacks. So that's one thing that life isn't. The drills aren't always going to prepare you for.
That's very alarming for me when I was reading that article, because how is it possible for persons as firefighters become obese? It should be this active, more keep being training all the time, or just redoing drills to keep you in shape. Actually,
that's again the reality of it is when I talk to these patients. It depends on your areas. So I'm sure firefighters, when I was growing up, always on the go. They're always busy, and they had to, just the job itself lent itself to being active. However, believe it or not, firefighters, when they're not in the fire, they're sitting around. So there's a kitchen, from what I heard. Okay, take cameras and watch everything. That'd be great. So I could not be assuming anything, but from what I've heard from firefighters, is that there's a kitchen you sit at, and there's a couch where you can watch TV. And so if you think about the times that you're not fighting fires, which every neighborhood is going to be different. Some are very quiet, and then maybe there's a big fire that happens that you have to go up. But for the most part, you're sitting quite a bit. It's a sedentary job. And unless you're motivated enough, there's some firefighters out there that do work out and they do their own training routines, but it has to be a self-motivated thing. There's no requirements to do that. So again, you can eat whatever you want. Sleep, you get disturbed with sleep. So when you sleep, your body recovers, it heals. So that's what the nice thing about sleep is. But oftentimes you're in a fire, you bolt out of your chair, you do the job, you come back to the firehouse, and then you sit for a long time. Right, so it's kind of a desk job if you think about it.
So
and then,
after the first passing the test to be a firefighter, there's no other requirement to do even a follow-up within a year or next 2 years? There are no other tests?
Well, from what I understand, I'd love for someone from the medical office to correct us if I'm wrong, but I think there's a pulmonary and cardiovascular test they do, like x-rays of your chest, because of the smoke inhalation and things like that. But as far as physical testing, like to make sure you have enough flexibility to crawl on the floor, to make sure that your hip muscles are strong, to make sure your shoulder muscles are strong to carry your baggage and to carry your air tank, they don't do that. So they make sure a lot of the focus in medicine is to keep you alive, and keep you healthy. When I talk about we talk about fitness and flexibility and strength, that's keep you alive but with quality of life. So they don't necessarily do that in the FDNY, and I really honestly think that they should, where almost yearly you should have a physical fitness test. I know the military does that, and fire department is paramilitary from what I've been told. So, however, these are people whose lives are in danger, and other people's lives are in danger. So if you promotes something that yearly or every 2 years, where firefighters have to pass a test. For example, I know pilots. My friend is a pilot. I know that they have to pass tests. They can't have certain diseases like diabetes or other heart conditions. So a lot of them are pretty active. And for a pilot, guess what? You fly and you sit for a long period of time,
Exactly.
and yet you know my friend is a marathon runner,
Right.
because if their job depends on it. So in this case for the fire department, your life depends on it, and other people's lives depend on it. So I think that there should be some type of enforcement on physical performance and quality of movement. So I think that should be a pretty important part of that department.
And what I've realized too, that it's not just affecting persons here, but in other regions, other part of the world, you'll find even the third world countries, you'll find that there's not so much physical demand. And at times I'll ask, but it sounds really harsh, like, aren't there enough fires? These firefighters, they become obese. They become, as you said, there's no fire. They sit down, they watch TV, there's no motivation, and they themselves have to motivate themselves. But as it relates to some of the drills that they do, we were watching a video of one of the firefighter pulling the hose.
Yeah, pulling the hose up.
That's how many? 20 pounds.
Yeah, something like that.
Is
And
that the correct
there's a
way?
banister too,
Yeah.
right? So
how
that
how
adds
would that
resistance.
affect the body though, in the way that they're doing that drill?
Again, so if you don't, for example, you're sitting for like 5 hours. There's no fire, and all of a sudden it's 6 o'clock and you have a fire. You have to run out, and you're that person pulling that hose up, right? Maybe the last time you did it was the day before. Maybe you didn't do it for a month.
Right.
It depends. And so you're pulling that up. So if your body is sedentary, it's going to forget how to use those muscles. So that's one part. So as he's pulling, there's a lot of stuff that goes on to it. Well, first of all, your bicep has to pull and have enough strength to pull the hose up. Then he actually turns around, I think. So in order for him to kind of have it on his shoulder to pull, he has to have enough leg strength. It's not just your shoulders or your back, but it's your leg strength and your ankle strength that give you that foundation to make sure that when you're pulling that hose, that your back doesn't have to compensate. And there's, so that's one of the things, that your body has to be alert all the time. So if you sit for a long period of time and you go do some activity like that, your body will forget how to use those muscles. So one muscle will get weak, and then another muscle will compensate, and now that starts a cycle of pain. So that's what I mean by being being consistent with physical activity. One quick little tip that I would say is that in your firehouse, every hour you do something that's aerobic in nature or calisthenics in nature, something that wakes up your muscles. So that's what that would do, is that I would break it down and say, all right, so as he's pulling, he has to have good upper back muscles, good shoulder blade muscles, good bicep muscles, good grip strength as well. He has to have good leg strength. As he turns around, he has to have enough flexibility for his thoracic spine, the upper part of your spine, to twist so that his lower back doesn't twist and cause a disc herniation, as many of us know. But it's so complicated, as you can tell. So it's not just about them being I don't want to say that you need to just be a runner and run 10 miles a day and in the firehouse. It's more than that. It's more complicated. So in one segment, I can't go through all the intricacies that they come. However, understanding the demands of firefighting, you can, and if you learn about your body, you can understand what exercises to do. So I think that's part of it. So if I can tell you about that part is upper body strength, lower body strength, having flexibility, but training your body when you're off duty, so to speak, like you're in the kitchen. Guess what? Take a hose and go upstairs and pull on it and just practice that. That's something like really, really basic and really simple. So that your brain says, oh, let's remind ourselves, so that in maybe a day or so there's a big fire. I have to do that. You're prepared for it. So it's like preparing for a test. All these fires are tests, and if you don't prepare for it, you're going to fail. And that's when you get injuries. And listen, these guys are tough. I mean, these are mentally and emotionally tough people. And so they're going to do it no matter what. I mean, there's one of my patients told me that he'd be sleeping, there's a fire, and he had a back problem. And he would stand up, and his leg would be numb. And he would kind of wait for a couple seconds, and he would keep going. So nothing's going to stop them. But imagine this. If he could get up from sleeping during a fire spontaneously and be able to run faster, they'd be in the fire truck faster, probably get to the fire a lot faster, do their job quicker, and do better.
You have so many firefighters who they don't use a gym or they're not a membership, should that be a requirement that they be a part of a gym, or a workout system per week should be a part of even the firefight, the office, where they have a gym to go to, they're motivated, they have a goal to set, all of that stuff?
Okay, so no, you don't need a gym.
Okay.
First thing is, like, we can do workouts right here that can talk about your profession.
Cool.
But even in the gym, in firehouses, they have weights and they have some equipment. But again, you don't need any equipment. All the equipment that they have is in their trucks in their firehouse, right? So they don't need to be doing barbells or doing all sorts of stuff. They have all the equipment there. Like I told you, if you're that segment where the guy's pulling on the firehouse and the drills, take the fire hose, go upstairs, and on the downtime,
And keep,
and practice that and do it as a workout.
Right.
But there's so many simple things that you can do. Even just flexibility stuff that you don't need any equipment for. You can do it on the firehouse anywhere. Pick a spot and do it. So those are kind of excuses that are really easy. I need a membership.
Right.
But you really don't.
Yeah.
You need a membership. So I would say, be creative and kind of use your own equipment, your firehouses, each other, and kind of ask each other about it. But there's equipment in firehouses. There's exercise equipment, and again, you don't need that much equipment to stay physically, healthy and flexible and strong.
Right. Even for some of the survivors from fires, and I'm sure they'll say, okay, please don't ask that question because bring us a lawsuit, but I don't think so. For a lot of fires, do you think if these firefighters were more fitter or even in a better shape, that you'll have more lives saved, more in terms of less deaths, basically, even for them in some instances where they're in the fire, and we have lost so many firefighters?
Yeah. Again, the firefighters that pass away, are heart attacks after the fire.
Exactly.
So, yeah, if you talk about a firefighter preventing a death of a firefighter, yes. Preventing a death from a fire, I don't want to be too definite about it, but if there's, the more in shape you are, okay, or the more alert your body is, or the more flexible you have, the easier it is for your body to see a debris falling out of the building and you move quickly and get out of the way. As opposed to if you're sedentary, don't work out, it's going to take you a couple seconds longer for you to get out of it, unless your adrenaline really kicks in. But then guess what? You have to worry about your heart, your cardiac arrest. So I would like to say that yes, but I would like to also challenge, departments out there to do studies and see if, by having a department increase their physical fitness. And again, it's not just about fitness, it's about being, preventing injuries. It's about being able to move well, no pun intended. So I think they should kind of see what their results are and try it, because right now the obesity rate is about 70% in firefighters. If you're in pain, you can't work out, because you're gonna say, oh, my knee hurts and it stops me. So that's another issue, is that you can be obese and have all the good intentions and try to work out, but if your knee bothers you, you can't work out as well as you want to. You can't get your heart rate up. So let's reduce injuries and discomforts really early on. Even in the academy, you talk about things that you don't continue with drills afterwards, but even in the academy, teaching cadets about injuries and preventing it. I was really honored to be offered a job with the Special Forces, and one thing they told me is that they do injury prevention courses. So why do the elite Special Forces get it, and why do firefighters not get it? So I'd say, teaching people about their bodies, cadets, and about injuries, and then being able to be fit and healthy can change a lot of stuff in our society.
And as we close, what's the most important thing that you want firefighters to understand about their body in terms of helping them survive or live longer and more fuller lives?
Well, like you said, if you pay attention to your injuries and don't ignore it. That's really the first thing. If you can change that aspect where, and I've seen this a lot of times, that patients said, yeah, I went back to my files in 96, I had a shoulder injury, in 97 I had the shoulder problem, I had this. Well, if you're taking care of it in 96 and not in 2015 now, you'd be at a different place. So my biggest thing is just don't ignore your pain. Get some help and take care of it now rather than later, because that will, make you perform less as a firefighter, propensity to be obese, and just your quality of life. There are people talking to me about outside there, they can't prepare their kids,
Yeah.
the young kids, that they have to think twice about, what leg they move on when they're a firefighter. Can they squat and kneel, or jumping off the fire truck? So it's about quality of life. You'll be happier.
Oh.
Think about just happiness. So don't ignore it.
All right. Thank you so much.
My
Thank
pleasure.
you so
Thank
much
you.
for being on Health and Wellness. And I'm sure a lot of our viewers are more alert and just learned about in terms of what you have said today. And I want you viewers to stay tuned as we join Dr. Robert Gucciardo with
Welcome to Living Well. I'm Dr. Robert Gucciardo, and today we will be talking about diabetes and what you can do to prevent or stop it. Diabetes, also known as diabetes mellitus, is a chronic condition traditionally marked by high levels of glucose in your blood, which is called high blood sugar. Type 1 is called insulin-dependent diabetes, also known as juvenile onset diabetes. And type 2 is called non-insulin dependent diabetes or adult onset diabetes. Rarely are people given the cause of death as diabetes. However, it is linked to many different degenerative diseases, such as heart disease, strokes, and even premature aging. In fact, in 2004, an estimated 3.4 million people died from the consequences of high fasting blood sugar. Currently, there are 347 million people worldwide that have diabetes. That number is projected to be 575 million by the year 2030. With all our advancements in technology we have today, we are still becoming sicker as a whole. Type 2 diabetes is a new epidemic among children. In the past, it was termed adult onset diabetes to distinguish it from type 1, which occurred in children. Today, this term cannot be used because of the growing numbers in children. The epidemic is said to be driven by poor diet and the lack of exercise. I believe that diet and exercise does play a role. However, there are hidden factors that have not been addressed until recently. New research is linking toxins such as dangerous chemicals and metals to the growing number of childhood cases of type 2 diabetes. Also, there are two hormones that need to be properly balanced in the body to maintain good sugar levels, and they are called insulin and leptin. Insulin is the hormone released in response to sugar from the diet, and the more sugar in the diet, the more strained the pancreas and insulin function becomes. Leptin is a hormone that is made in the fat cells. One of leptin's primary roles is regulating your appetite and body weight. It tells your brain when to eat, how much to eat, and most importantly, when to stop eating. And leptin tells your brain what to do with the energy it has. Leptin is largely responsible for the accuracy of insulin signaling and whether or not you become insulin resistant. Type 1 diabetes, which is an autoimmune condition where the body is attacking the beta cells in the pancreas, has been linked to genetics and toxins already. The toxic link to type 2 is still not making its way into treatments, even in the alternative world. This is unfortunate because if you don't eliminate the cause, we will never find a cure. There is also a structural issue called an upper cervical subluxation, which causes body imbalance. That has been related to diabetes as well. Subluxation is the term used when the top two bones in the spine, the atlas and axis, are moved from their normal position and compress nerve tissue in the upper neck called the brain stem or spinal medulla. These structural issues, called subluxations, are addressed by doctors of chiropractic called upper cervical specialists. Brain health and healing messages need to travel over our nervous system to all parts of the body as electricity travels over wires to our homes and factories. These brain messages keep all parts of our body, including the pancreas and hormones like insulin and leptin, functional and healthy. Like electricity supplies lights to our homes and factories, when head and neck misalignment at the upper two bones develops, it disrupts the normal flow of these brain messages to the body. This leads to the development of acute and chronic health problems. So what can you do to help prevent diabetes or help to reverse it? Well, first, you need to exercise. Contrary to prevailing recommendations of shunning exercise during illness, staying fit is highly important in getting diabetes and other diseases under control. In fact, it is one of the fastest, most powerful ways to lower your insulin and leptin resistance. You also need to eliminate grains and sugars, especially fructose. Conventional diabetes treatment has failed over the last 50 years, partly because of its seriously flawed dietary principles. Eliminate all sugars and grains, even healthful ones like whole, organic, or sprouted grains from your diet. Avoid breads, pasta, cereals, and rice, potatoes, and even corn, which is in fact a grain, until your blood sugar gets under control. You may want to avoid fruits as well. Also, you can consult an upper cervical chiropractor to see if you have a subluxation that might be contributing to your condition. There are also some foods to include in your diet. Cinnamon is one that can slow the emptying of your stomach to reduce sharp rises in blood sugar following meals. It improves the effectiveness or sensitivity of insulin and enhances your antioxidant defenses, which will protect the pancreas from toxins. Also, vitamin K, which can be found in herbs such as dried basil, dried sage, and dried thyme, green leafy vegetables such as kale and spinach, Brussels sprouts, onions, and broccoli. Research shows that vitamin K can help to regulate your glucose metabolism by converting to a substance called carboxylated ostecalcin in your body, which affects, again, your insulin sensitivity. Also, using probiotics to optimize your gut flora. Your gut is a living ecosystem full of both good bacteria and bad. Multiple studies have shown that obese people have different intestinal bacteria than leaner people. The more good bacteria you have, the stronger your immune system will be, and the better your body will function. Overall, unfortunately, optimizing your gut flora is relatively easy. You can replenish your body with good bacteria by eating fermented foods, such as fermented vegetables, raw organic cheeses, or raw milk kefir, or by taking a high-quality probiotic supplement. But I want you to remember, the best thing to do for prevention and even for restoring and repairing the foundations that have been lost is to eat whole, fresh foods. The closer you eat to natural, the better. The less exposure to toxins from pesticides and other harmful preservatives and chemicals, the more efficiently your body will work at the healing process. So we need to use wisdom and see what we are really eating. And we need to get back to the basics and eat whole foods. So if you have any questions about diabetes or any other health problems, please feel free to email us, and we are here to help to get you on the right path in your health journey.
Thank you so much for watching Health and Wellness on Brooklyn Public Network every 4th and 1st Wednesdays at 5 p.m. You can also catch the episode on our YouTube channel at Health and Wellness with Rose and Green. Thanks for watching.